Treatment procedure timeline. This is very important for people who are coming from outside the center, that is, outside Chennai. Many people ask when they take this advanced treatment, what is the time frame? In how many months will I get pregnant? And the other question is, how many months I have to stay here in Chennai? I'm Dr. Archana Ayyanathan from Dr. Archana IVF Chennai. So now I'm going to discuss about what is going to be a timeline and what is going to be like the number of days of stay required for anyone coming from outside Chennai. See, IVF and these advanced treatments are all day care procedures. There is no place for any stay which is required in the hospital for the patient. So, but this is applicable for people who are in the same place. That is, if my center is in Chennai, it is applicable for the people who have a house in Chennai. What about people traveling from outside Chennai? For them, they need to look for an accommodation. They need to arrange their, the travel and their food also, right, to have their treatment. So when a couple is coming from outside Chennai to my center to take treatment, this is the general advice we give them about their stay and how long they can expect the treatment to be completed. The husband wife both have to travel together, preferably between their day 18 to 21. So when they come between day 18 to day 21, that is optimum time where I can evaluate the lady and husband, both of them together, and there is a time frame of at least 10 days left for me before her period comes, so that I can give her some pre-medication. Soon after her period starts, the stay of the patient in Chennai is going to be approximately 10 to 15 days. So that is required because we will be giving the lady the injection from second day of her cycle for 10 or 12 days. So for that period of time, every day the patient has to visit the center, take the injections. Every alternate days, certain scans will be there to find out if the injection what I'm giving is really giving a difference in her body. Is there any reaction properly happening or not, and should I increase the dose of the medicine or not? So for this, there is going to be definitely a stay of at least 15 days where this egg collection process is involved. The 15 days for ovarian stimulation and for egg collection. After this, if we are planning for a fresh transfer, the stay will get extended for another 10 days because we are going to see how the embryo is going to grow. If all the ladies' hormones, everything is perfectly fine, we can plan for a fresh transfer. But these days, fresh transfer, everyone knows that the results, the success rates in fresh transfers are very less. Frozen embryo transfer is a better option. So the patient can actually go back to their hometown or their home country and come back and visit us again for their frozen embryo transfer. So the next step is going to be frozen embryo transfer. For the frozen embryo transfer, again the number of days of required stay is going to be about 10 to 15 days. So we will be giving all the medications. They can carry the medications with them. They can take the medications, and on the prescribed date they have to come, and there will again be an alternate day scan, and some injections will be given to the endometrium growth, and when the endometrium is optimum enough, we will transfer the embryo. So after the embryo transfer, it is again completely safe to travel back to their country or to their hometown, because there is no admission required. You can go back to your home soon after embryo transfer. Walking or mobilizing is not going to affect your embryo transfer in any way. So when the couple is traveling together, you should keep in mind it's the first 15 days which is very important, where the egg collection process is going to be done. And when you're coming back for a frozen embryo transfer, after a month or a 2-month gap, you can come back for a period of 15 days. So you plan your travel in such a way. And one more important question which the people ask is, should the husband stay for this whole 15 days? No, that is not at all required, because everybody will be working, and everybody cannot stay there with their wives. So in that scenario, the wife alone has to stay for the first 15 days, and the second 15 days also is the same thing. The requirement of the husband is just 2 days. One is initial checkup where we evaluate his sample, and then second is during the egg collection time, when we are going to take the eggs out of the body, he has to give his 7 sample so that we can use his sperm. But in certain conditions where the husband cannot travel again and again, he can come only once and meet us. In that point, he can give his 7 sample 2 or 3 times. We can freeze a backup sample and keep, and we can use that sample for the when the egg collection process is happening. So that also can be done. So keep all these points in mind when you're traveling from a place outside in Chennai, so that your treatment procedure is going to happen smoothly and you can end up having a successful result.